and we talk about reopening, we talk about reimagining. Let's start to put some meat on the bones of what we're talking about so people understand. The federal guidance from the CDC is that before you start reopening, the state and the regional hospitalization rate must be in decline for 14 days, okay? That's the CDC's guidance. The federal government leaves it up to the states, it's up to the governors, but they also give guidance. And in this case, I think the CDC guidance is right. So we're monitoring the hospitalization rate, we're monitoring the regional hospitalization rates. We said in this state, it's a very diverse state. Upstate regions are like states in the Midwest, even out west. And we have very different hospitalization rates, so we look at the rates all across the state as well as across the regions. We're going to reopen in phases, a regional analysis on what we call our economic regions that we've been working with the state on, and those regions have been working together on economic policy, et cetera. So to analyze the regions which are existing coalitions actually works. But look at the regional analysis, make a determination, and then monitor whatever you do. Phase 1 of reopening will involve construction and manufacturing activities. And within construction and manufacturing, those businesses that have a low risk, right? There is a range of construction activities, there's a range of manufacturing activities, but those businesses that pose a low risk within them. Phase 2 would then be more a business-by-business analysis using the matrix that we've discussed. How essential a service does that business provide, and how risky is that business? If you reopen that business, how much risk are you possibly incurring, and how important is it that that business reopen? And that matrix will be guiding us through phase 2. In phase 2, when we get there, we need businesses to do that analysis. They have to think about how they're going to reopen with this quote-unquote new normal. What precautions are they going to take in the workplace? What safeguards are they going to put in place? So it's very much going to be up to businesses. Then we're going to leave 2 weeks between phases so we can monitor the effect of what we just did, right? Take an action, monitor. 2 weeks, that's, according to the experts, the incubation period of the virus, so you can actually see if you had an effect where you increase the rate of infection, which you would then see in hospitalizations, testing, et cetera. So everyone understands the overall risk that you start to increase activity, the infection rate goes up, 2 weeks to actually do that monitoring. That's the broad outlines of the reopening plan. And then you get into caveats. One caveat is you can't do anything in any region that would increase the number of visitors to that region, right? You have a whole multi-state region in lockdown here. It's possible that you open something in Syracuse or you open something in the North Country where you now see license plates coming in from Connecticut, New Jersey, people from downstate, all coming to that area because they've been locked down and they're looking for an activity. So that's something that we have to pay attention to. And all of this is done in a multi-state context with our neighboring states, most relevant, especially downstate. Downstate is obviously the most complicated situation. That's New York City, that's Westchester, Nassau, Suffolk, the surrounding suburbs. Multi-state coordination is vital there because the New Jersey, Connecticut, New York City area is basically very intermixed. People are going and coming. They live in one place, they work in the other place. So that coordination is important. You get upstate, coordination with Massachusetts is more important in some areas, right? Some parts of the state, Pennsylvania coordination is more important. So coordinating with those states that are neighbors to that region. Downstate, we've said we have to coordinate the main activities There are gears that intermesh. You can't turn one gear without turning the other gears. That's how you strip gears. Keep trying to explain to my daughters. Transportation, parks, schools, beaches, these are all coordinated activities, right? You turn one, they all have to turn. And that's true for New York City, Nassau, Suffolk, Westchester. They all have to be coordinated. And we're working with local businesses and leaders to do that. Again, on the phased reopening, does my business reopen? Well, what is your business? And how would you do your business in this new normal? You normally have people in a conference room. Are you going to do that? You normally have people in workstations that are right next to each other. Do you plan on reopening that way? So this is not a one-sided equation here. Businesses, you develop a plan on how you would reopen given everything we now know. And if you have a plan, I'll show you in a moment, that actually takes into consideration these new circumstances, more essential, lower risk. The way a business opens will determine the risk. They can't really determine how essential their service is, but they can determine how risky opening them up, opening their business would be. Also, we need them to be creative and think outside of the box. And we've been speaking with business leaders across the state. But some people even need a new economic model. We want to bring sports back, right? So there's an activity that people can watch on TV. What sports can you do without an audience? What sports can you make work economically where you don't have to sell a seat in the stadium or in the arena? How do you do drive-ins? How do you do different types of businesses that could actually work in this environment? And again, they have to be creative and they have to think about it. Downstate, which does have particular needs, we need summer activities in downstate New York. You can't tell people in a dense urban environment all through the summer months, we don't have anything for you to do. Stay in your apartment with the 3 kids. You know, that doesn't work. There's a sanity equation here also that we have to take into consideration. Special attention for public housing residents, special attention for low-income communities that, number one, paid a higher price for this disease than anyone else. We talk about the racial disparity, African Americans and Latinos. We're increasing the testing. We're going to have more to say on that this week. But lower income communities need more assistance through this. And I also need to focus, we need to focus on the basics. We need more food banks, more food assistance. There are people who literally are struggling for food and for child care. We have to make that more available. And I want to bring in a coordinated way, the philanthropies. There's a lot of goodwill. A lot of people want to help. Philanthropies represent a positive force in our society. I want to make them part of this in a partnership, and we're doing that. So working through all of this with partners in the business community and the healthcare community, right? Because we have an economic strategy and we have a public health strategy. It has to work with businesses who are creative and more thoughtful, and healthcare professionals who just learned a very important lesson with what we went through, and I don't want to lose that lesson. In terms of businesses, thinking about the new normal, think about it in terms of people. How are you going to protect your people? What are you going to be doing differently with your employees? Your actual physical space. What does the physical space look like when you reopen in this new normal? What are you doing about PPE equipment? How are you cleaning? What's the hygiene? What's the access? What's the screening? How do you move people? What's the travel and transportation? And then what processes can you put in place to make your business less risky, right? How can you train people? How can you communicate about this disease? Can you do testing in your workplace? These are all factors for businesses to consider that want to reopen quickly. And again, it's between the two, it's governmental decisions in partnership with business decisions. Because I think every business leader gets, you can't go back to where you were. We have to go back in light of the circumstances that have developed.